So, tropical diseases that have been around for centuries and can do and are doing a lot of damage. Patients across Nigeria and many countries in Africa and Asia are battling these diseases, 20 devastating ailments that can kill, blind, maim, and disfigure their victims. They're called neglected because they affect the world's poorest and receive less attention than other diseases, causing unspeakable agony for nearly 2 billion people, 40% of whom live in Africa. Sadly, Nigeria ranks second amongst the high-burdened countries for neglected tropical diseases after India. So this week, the Nigerian national team on neglected tropical diseases convened a high-level meeting with representatives from the different arms of governments, development partners, and the private sector to try to combat neglected tropical diseases. And Arise correspondent Itoro Udofia went along to the event.
Neglected tropical diseases, or NTDs, is a term that many of us may not have heard before. But if you live in Nigeria, you've probably seen someone who lives with an NTD. NTDs are common in tropical areas and can be easily contracted if you don't have access to clean water or proper sanitation. Nigeria is the second highest country with NTDs, with people suffering from diseases like leprosy, guinea worm, trachoma, and rabies.
He has been suffering from this elephantiasis disease for the past 30 years. At some point he was operated on and they even removed some fluid and water from the leg. And then of course it relapsed again because the medicines he was taking got finished. Because of his elephantiasis, the wife is threatening to leave him, to quit the marriage. They said he's praying everyone in the hall and government, particularly to please come to his aid so that he can be able to get something to do. But because right now he is jobless, he doesn't have a means of livelihood. And so even getting money to move around to go to the hospital becomes a Herculean task for him.
Members from the public and private sector, NGOs, and academicians are pushing for the country to tackle this issue. They're calling for a coordinated effort to eliminate NTDs in 5 years.
We're on track to eliminate some of the NTDs. We're on track to eliminate onchocerciasis. I think the common name is river blindness. And then there's also trachoma, which causes blindness. And we have been working very hard in this area. The NGOs have been providing, supporting the government to provide so many services. So I was listening keenly to when the people living with NTDs were talking. And one of the things it may interest you to know is that the NGOs support the government to do mass drug administration, which is going from door to door to distribute the medicines for these NTDs.
Since these diseases mostly affect poor populations, many need access to good health care. And representatives calling for change say this should be a basic right.
When we talk of universal health coverage, the first thing you are talking about is accessibility to healthcare delivery. Again, you want to ask that, is it available? Is that healthcare delivery available?
They're also calling for a long-term plan to curb and track the spread. What's needed now is efficient data gathering, adequate monitoring and evaluation at state, national, and local levels, and the immediate distribution of medical supplies. These diseases are neglected, and in the age of COVID-19, those who are affected are left to suffer in silence. But it's preventable and curable, which means this particular endemic can be solved. Itoro Udofia, Arise News.
Well, that looked particularly horrific, didn't it? And thanks to Itoro there for that report. Well, for more on this, I'm joined now in the studio by representatives of 2 NGOs that are working with the Nigerian government, development partners, and the private sector to try to end the scourge of neglected tropical diseases. Rita Oguntoyibo is president of the Amen Healthcare and Empowerment Foundation, and Bright Ekweremadu is country director for Christopher Blinden Mission International. Thank you very much indeed to both of you for coming in. These are clearly horrific diseases. I mean, just looking at those pictures, I'm absolutely, not only appalled, but certainly have tremendous sympathy for those who are going through it. But they've been around for centuries. That's the problem, isn't it? And should have been eliminated by now. I mean, yet they are still around, afflicting the poorest people in the world, in Nigeria, causing untold suffering. Tell us more.
Yes, it's been there for ages, and one would have thought that by now we would have made more progress. The NGOs are making a lot of effort. First, we're less than 20, supporting government in Nigeria, and most of the funding is from abroad, ironically. And I believe that if government at all levels would work with the NGOs who are working, we will get more accelerated success. I believe that if we all put our resources together, we'll be able to achieve much more at a faster, within a faster period.
And Mr. Ekweremadu, she says, if the government and everybody comes together, that sounds like they're not coming together.
Yes, I would agree with Rita that there's a lot more that needs to be done, particularly in the area of synergy and collaboration of efforts. The international NGOs, the donor agencies, has a duty, so to say, because of who they are, to come to our aid to help us. But the people who suffer these diseases are
well, you'd
our
think
people.
the Nigerian government had a greater duty.
Absolutely, they are Nigerians, so the Nigerian government should be on the driving seat. I guess that's where we are going to. But that doesn't mean that we are not doing things together in collaboration, but I think there's a lot more to be done in collaboration.
Right. So what are you doing with the government? I mean, and obviously this needs to be ended. And I suppose the question is how?
Well, we get funding from abroad to support, to work with government, collaborate with government, starting with the federal government, the Federal Ministry of Health, which has an NTD unit, and they are the ones who actually allocate states to the partners and say, please support so and so states. And then we go looking for funding to be able to support such states. And I would expect that the federal government would have an allocation to support
its own allocation,
yes,
right,
its
rather
own,
than depending on somebody else, right?
Its own allocation to support the technical support expected of its staff. Because the staff at the Federal Ministry of Health are expected to provide technical support by training the state team, by doing oversight visits to ensure that we all work in line with the regulations.
And clearly that isn't happening.
Yes, that's not happening.
Right. So yesterday, sorry to break in there, I mean, or this week, you had a meeting with the government as well as development partners, you know, private sector, NGOs, all the rest of it. What did they say to you? I mean, what are the reasons why they aren't doing it? Because this is clearly something that needs to be dealt with.
I think first I would want to commend the Federal Ministry of Health in the first place.
Well, you're commending them for clearly not doing enough.
Well, they are not doing enough doesn't mean they are not doing anything at all.
Yeah, but anything isn't enough, is it?
Yeah, so I think I'll go even beyond the federal government. We have the 3 tiers of government in Nigeria. We have the state government, they all get their allocation from the center. We have the local governments, even if they don't get all their money, as we are hearing, they get something. And the essence of having the grassroots tier of government, which is the local government, is to be able to work from bottom up. So I think where I personally think that a lot more need to be done is at the state and local government levels.
Well, the local governments in most cases don't exist in Nigeria. They only exist in words. I mean, they don't have their resources are essentially not available to them to use as they would want to use it. That's a known fact in Nigeria.
And that's very, very unfortunate.
So you would be talking more about the state and the federal government levels.
Right. Now, at the federal government level, for instance, like I said, we have a a division in charge of neglected tropical diseases, which to my mind, the very first step, that it is now the responsibility of somebody. And the work in NTD rests on somebody and on somebody's desk. And I think this unit has quite a number of very technically sound people. But what I guess Rita is saying, and we are saying, is that they need more resources from the government, at least to take care of our own portion, while the donor agencies help, instead of the other way around.
Yeah, that's a good point. And Rita, you were saying, I mean, we read your, all the press releases and so on and so forth about these neglected tropical diseases, and the reason they are neglected is why? Is it because it afflicts the poor? What is the reason?
Yes, it's because it afflicts the poor who don't have a voice. And they are the poor who don't have the resources. And usually when they are afflicted, they are the same people who don't have access to information. They are the same people who don't have resources to access good medical care. And so when they fall ill, they just hide themselves. They hide themselves. We saw a case of a man who had hydrocele so huge, beyond the knees, and the explanation the surgeon gave me was that he's lived with it for 20 years, and the reason for not being able to access health is because he doesn't have the resources. And that's not surprising, because there's so many people who are just managing to feed, and so going to hospital, even transporting themselves,
that's an additional expense.
Yes, which they can't afford to do. And some of them do not even have the information. They're not aware that they can access care.
Right. Well, we have to thank the heavens for NGOs like yours, but please stay with us because we want to come back and talk with you a little bit more. You're watching the Arise interview. Plenty more still ahead as we continue our chat about neglected tropical diseases and what's being done to try to end them. Stay with us. Welcome back to the Arise interview. I'm Charles Anyagolu. Now, there are people trying to fix the world and to empower the afflicted poor in the rural and low-income areas of Nigeria. Nigeria, of course, just one country where diseases such as leprosy, elephantiasis, trachoma, and guinea worm are all too common. They're all neglected tropical diseases, ignored for decades by modern medicine and the big pharmaceutical companies. But now, the Nigerian government, along with NGOs, members of the National Assembly, donor organizations, and the private sector, have all come together to try to eliminate these diseases in Nigeria and to help the millions of patients who suffer from them every year in this country. And with me in the studio, representatives of two NGOs that are working with the Nigerian government, development partners, and the private sector to try to end the scourge of neglected tropical diseases. Rita Oguntoyibo is president of the Amen Healthcare and Empowerment Foundation, and Bright Ekweremadu is the country director for Christopher Blinden Mission International. Thank you very much indeed for staying with us. And Nigeria, of course, let me come to you, particularly badly hit. I understand it's the second in the world after India. More than 120 million people at risk of these diseases, so more than really half the population. I mean, that's pretty alarming, isn't it? But that's not alarming enough, the sheer numbers, for really decisive action to take place so far.
I completely agree with you. It's an alarming number, really. Like you said, it's more than half of the country. And most of these people, obviously, are the poor who live in hard-to-reach areas, the rural communities in Nigeria. Like we said, a lot need to be done. I will cite an example of some of the things I think we need to even get our house together. The donor and the pharmaceutical companies donate commodities to us, these drugs, for instance. And sometimes it takes a very long time for them to be cleared through the ports. That's unacceptable. When they are cleared through the ports and taken to the warehouse, you see another difficulty in getting them out to where they are needed. Again, very unacceptable.
Bureaucracy, basically.
Well, I don't think it's bureaucracy. I think it's more of there is even no fund to do some of these things.
Right.
So when we talk about the government...
enough funds allocated to it.
Exactly, funds allocated to them. So that even makes the neglected tropical diseases more neglected. Because here are free drugs that are already in country, and all we need to do is just pick them up from the port, take them to where they are needed, and the NGOs are out there ready at every point in time to get them distributed. We've had instances in my organization, for instance, where we had to return money to the donors because money is donated, money is made available for distributing these drugs, but the drugs are not there to be distributed. So at the end of the year, you find out that the money has to be returned to the donors. That's very sad.
Yes, obviously. But I'm curious, Rita, to know whether you raised these issues. I mean, that's a very important point he's making. Did you raise that at the meetings you guys had this week with the government and all the rest of it? And what was their response?
Well, the meeting we had yesterday was at the instance of the Nigeria, the NNTT, and under the chairmanship of Senator Oluriegbe. And he was actually trying to see how he can use his good offices to mobilize people to support a drive for funding of the neglected tropical diseases.
But didn't you raise the challenges that you face?
Yes, we did.
Right,
and the minister is already aware.
Right.
Because the NGOs in September held a meeting, and we met with the minister, and we tabled all the challenges we are having. So they are very much aware. And I do know that the minister himself has tried to intervene in some instances. But what we're saying is we really need to work together and be able to ensure that all the bottlenecks are removed.
Absolutely.
The drugs are donated. UNICEF and WHO pay for the freight and clear them. But the problem is the bureaucracy in clearing. Papers are waiting there to be cleared, IDEC, this, that. It gets to NAFDAC. NAFDAC is holding it for some time, and we just waste so much time.
It's ridiculous.
Trying to get the medicines out. I think this is a big issue that we think, I believe that if government is actively involved, if the president is involved, just like the polio program, when the president came out to say, I am in charge, I'm involved, I want to participate in this, the governors followed suit. Everybody knew that the president is involved in this, and nobody would keep polio medicines hanging anywhere. It's the same thing. The program is neglected. And what we want to see, which Senator Oluriegbe is trying hard. I'm really excited that he's taking up this challenge and that he's working. He's been able to get some of his colleagues, like the chairman Senate Committee on Water. As you know, there's so many factors.
Well, sanitation is a big part
yes,
of it, yeah.
Sanitation, wash. And when you're able to get everybody to be on board, and the government says this is our problem, the corporate world will come along, and everybody will be able to work better.
No, you've got very good points there. And let me ask you this, Mr. Ekweremadu. I mean, how do these people in the interim, given all these bottlenecks, actually treat themselves? I mean, because clearly there hasn't been enough research into a lot of these, ailments. Drug companies need to fund it more, but, they haven't, because there's not that much sort of capital incentive for them to do it, because the people can't afford to pay for it. So how do these people sort of live from day to day and treat themselves and all the rest of it?
I think first to say that there has been a lot of research into these diseases, and the drugs are out there that actually cure them.
So they're all curable?
Yes.
Yeah.
Right.
They are curable.
They're preventable.
Yeah, preventable and curable. Right.
And the medicines are there. So the question becomes, how do we get these medicines available, and how do we promote some of these hygiene and health issues?
But these are things that occur in the developing world.
Yes.
Right, and particularly in sub-Saharan Africa.
Absolutely.
Right.
Now, just going a bit further, I think we also need to look at integration here. Trachoma, for instance, is one of the neglected tropical diseases that wash which is water, hygiene, and sanitation, will go a very long way in eliminating. But again, how many Nigerians have access to potable water? So that's a big question.
So it's got to be a much wider issue. It's not just trying to get rid of this. You've got to worry about, the supply of water and this and that and all the rest of it, which involves a much bigger government intervention.
Absolutely.
And the government is going to throw their hands up and say, we don't have the resources to do all that in order to eliminate this. Someone in that video that we saw, that Itoro put together, said they were on track to end neglected diseases in 5 years. What does that mean in real terms from your point of view and your assessment?
Well, the WHO has come up with a global deadline target, which is called the 2030 roadmap. And the roadmap is encouraging all of us to try and eliminate the entities, particularly onchocerciasis and yours, and to bring to the barest minimum all other entities. I think, and this is 2030, not in 5 years, 10 years. And I think this is possible. It's possible. If government will take the driver's seat, we can do it. Because what it means is for us to ensure that every eligible person gets the tablets on his palm and take them. But as we speak, not every state in the country has a partner. Because as I said, the Federal Ministry of Health appeals to the few partners to say, please take on this state, take on that state. And you now have to look for funding. So if you find funding, then you can.
Okay. Well, we must keep an eye on this, and please come and talk to us again. I want to thank both of you very much indeed. Rita Oguntoyibo and Bright Ekweremadu, thank you ever so much.
Thank you so much.